Then there is the last topic, which is destructive ocular surgery. There are three main types of destructive ocular surgeries. Enucleation, which is removal of the eyeball with a part of the optic nerve, as you can see in this picture. So the end of the procedure, the stump of the optic nerve is left behind. That we have to leave, and the eyeball is. This is one of the Viva question that they ask us. What is the most common indication for enucleation? The answer is donor eye in cadaveric patient. If the patient wants to donate eye and we have to remove it, that's when we do enucleation or scleral button. But mostly we do enucleation. So that's the most common indication. That's in a dead patient who wants to donate for the service. So intraocular malignancy like retinoblastoma, we do enucleation. We don't wait for evisceration, all these things. Severely traumatized eye, to prevent sympathetic ophthalmia in the other eye, we can do, or painful blind eye, we do enucleation. Absolute contraindication include panophthalmitis. Why? Because in the case of panophthalmitis, the infection can spread. That's where we should never do enucleation in the case of panophthalmitis. But coming to evisceration, is a procedure in which a corneal button is removed and the intraocular contents are scooped away. Frill of the sclera attached to the optic nerve is left behind. Extraocular muscles are left behind. So indications here is panophthalmitis, because that's an absolute indication, because if this panophthalmitis, you have to scoop off all the content and leave that sclera. Otherwise, the infection can spread into the optic nerve and into the brain, which is a dangerous condition. So we cannot do enucleation in the case of panophthalmitis, whereas evisceration is the indication here. But there the indication was intraocular malignancy in enucleation, because we need to remove as much as possible of the cancer. But here evisceration is absolutely contraindicated, because what are we going to save in the case of malignancy? We are not going to save much with the evisceration. So it's better to remove rather than allow the malignancy to grow. So this is how the eyeball looks after evisceration. There will be only coats of the sclera. So the big advantage of evisceration is that we can put an implant, we can give an implant ball, and then we can have a good motility, so that the patient doesn't seem as having enucleated eye. Now there are a lot of latest corneal implants have come, corneal and scleral implants have come. So it's easier to mimic the eye like a normal seeing eye. Then comes the excenteration. This procedure is rarely done now. It involves removal of the globe, orbital soft tissue, periosteum of the orbital wall, and part of the whole of the eyelids. The indications are orbital malignancy and mucormycosis. These two conditions, where orbital malignancy has extended or mucormycosis has extended, that's when enucleation cannot work much. That's when we do excenteration. Otherwise, this is not a procedure. This is a very destructive procedure which we don't tend to do. So